thank you so much for joining us for Asthma Awareness Month. We're doing our 3-part series. Our first interview was with Kim, who discussed her experience with asthma and how she was able to manage it. Last week, we had Dr. Kate Taylor, who discussed how she helped her son who has asthma. Today, we have Dr. Robinson, who is an assistant professor in the Pediatrics Department and also the medical director for UNT Health Science Center's mobile clinic. Hi, Dr. Robinson.
Hi, Katie.
Thank you so much for being with us today. Dr. Robinson is going to discuss her experience with children and students who have asthma and kind of something she sees on a regular basis. So first, I wanted to get started on, my first question is, what are some warning signs of a child who might have asthma?
Well, first, I want to thank you for this opportunity to be able to visit with you today. And yes, asthma is a really common diagnosis, and the symptoms can be often overlooked in young children because the symptoms often are cough, wheezing, shortness of breath. And oftentimes they can be mistaken for just a common cold. But the tipping point is the duration and the frequency that they have these symptoms.
Okay. And so when someone, when a child or a mother thinks that their son or daughter might have asthma, when should the parent take their child to the pediatrician?
Excellent question. So typically when we have a child who's had those symptoms of cough or wheezing and it's been longer than a couple of days, so 1 to 2 days, that's typically when we ask that you bring the child to see a healthcare provider so that we can do a little bit more diagnosis and provide guidance.
Okay. And I know when parents are, this is new for a parent, what are some questions they should ask their pediatrician when they might suspect that their child has asthma?
Yeah, so really common questions that I often receive from parents are, what does this mean for my child? And are there things that they should not do now? And honestly, we want to control symptoms of asthma and manage the disease in such a way that it does not limit a child's ability to participate in any activities that a healthy, normal child would do. Mm-hmm. But we want to help to remove risk factors or triggers for that child so that they are not likely to succumb to symptoms of asthma.
So when you do diagnose a child with asthma, there's been different things of severe asthma and mild and moderate asthma. Can you kind of explain what's the difference between those and what signs, what symptoms do people have when they have either or?
Excellent question, and you're right. So we as physicians and providers classify asthma between intermittent and persistent. That's the first branching tree. And then the second is whether it is mild, moderate, or severe. And it's typically used when we're talking about persistent asthma. So if we have someone who has symptoms only 2 times a month, and those are the symptoms of the coughing that's persistent, coughing at night, wheezing, shortness of breath, that would be more of a mild disease severity versus if we have someone that's having symptoms that are daily or that require oral steroids more than a couple of times a month, that would be more severe.
Okay. Now you mentioned, we always want to prevent a child from having to go to the ER and where it becomes really severe. What can a parent do to prevent a child from visiting the ER or having frequent asthma attacks?
Yeah, so prevention is really about trying to remove those triggers or those risk factors for asthma, and a lot of them are environmental. And so that's what allows us to have some level of control. And so a common one is cigarette smoke. So we know that cigarette smoke is a really potent trigger for a lot of our asthmatics, as well as allergens like dust and pollens. And so simple things like not permitting people who have smoked to smoke, or people who smoke to smoke in your home or the car, And then asking those who do smoke to wear a particular shirt when they're smoking and to take that off and leave that outside with their smoking devices, and then wash their face, hands, and exposed skin as they're returning into the household. In terms of dust and pollens, typically having allergy cases that you place on pillowcases and mattresses are a great way to try to minimize those. And then we want the children to play outside because that's a great way to get exercise. And just asking that when they come inside that they wash their face and hands and any exposed skin. If they were rolling around in the grass, as a lot of little ones do, then it's just changing those clothes so that they're not continuing to inhale those pollens.
Okay. Now, we are located within Tarrant County, and you kind of mentioned some of the asthma triggers, but what are some common ones you see within Tarrant County or that you see really often around this area? And then when do you see that these triggers flare up the most?
Yes, so other common triggers are colds, right? And so we typically see a lot of colds and viruses in the winter season. And so a lot of children will struggle with asthma exacerbations during the winter and fall when we tend to have a lot of those colds and upper respiratory infections. But then also, as we mentioned before, allergies are a common trigger. And so for Texas, we typically have a peak of allergy
Yeah.
sufferers. That fall season and that spring season tend to be the worst heavy hitters. We do have some that are susceptible to grass pollens, and that's more common in the summer, but not as common as our fall and our spring.
And then, so you work with children, and our asthma 4-in-1 program works a lot of with the school nurses within Tarrant County. What advice do you usually give to parents working with their child's school or school nurse and making sure that um, they have the correct medication at school in case of an emergency?
So usually we want to encourage families when they're going for their yearly physical to do so and bring up these measures so that we can make sure that the form that allows the student to use their rescue inhaler has been signed and provided to the school. And also we want to make sure that there is an active asthma action plan on file for the student with the nurse. And an asthma action plan actually empowers the student as well as the nurse to recognize the signs of asthma and to know when they need to activate use of their short-acting rescue inhaler, and reminding the students that they should have used their long-acting inhaler or controller if they were needed for that particular season or time of year. Also, making sure that the nurse and the parent and the provider have open lines of communication. And you want to ensure that if a nurse does have concerns, that they are able to communicate that to the parent. And in the event of emergency, if the parent is not available, feeling comfortable with communicating with the provider so that the care can be provided for your child.
Okay. And then at what age do you see that students and children can start managing their own asthma? You know, when kids are younger, the parents kind of have to explain to them and make sure that they help out with the school nurse and make sure they understand. But at what age can a child manage it and kind of know what's going on with their body?
Really good question. So oftentimes we have these conversations during our well child visits in the middle school years
Okay.
as students are starting to become a bit more independent. The keys to independent management of their asthma is not only being able to use their short-acting inhaler, their rescue inhaler, well, which they should be able to demonstrate that during the exam,
Okay.
but also, as you mentioned, being able to recognize signs of asthma. And so for some patients and students, they have more insight than others. Um, and so there's no hard and fast rule about a particular age, but it's about when they are able to communicate well to us as the provider and to the parent that they feel that they need help breathing. And that can be from the coughing to the shortness of breath to the wheezing. As they become older, oftentimes, though, students will be able to communicate that they have tightness in their chest. And that will often precede the other symptoms. And that's a valuable um, indicator that they are starting to experience an exacerbation. So, them being able to communicate how they feel is really key to being ahead of the exacerbation and prevent the need for more intensive measures.
Okay, when can a child ever outgrow their asthma? So I know a lot of people, they were diagnosed when they were younger, and then by the time in their adulthood, it doesn't seem like they have nearly as many symptoms or triggers that they had when they were a child. So is that common for a child to outgrow it, or do they just manage it better?
Great question. And I think right now we are still looking at the science behind that. So we know that there are some instances of children who were diagnosed with asthma who probably actually had bronchiolitis, which is a different diagnosis. We know that there are some children who are diagnosed with asthma and their asthma severity changes over time. So instead of being a persistent moderate asthmatic, they become a persistent mild, and then into adulthood, they may become an intermittent asthmatic. And then there are those who are late to diagnosis. So it is not uncommon for us to have some children not receive their asthma diagnosis until their middle school years, especially in girls, and that's what's kind of emerging in the science.
Okay.
And in that regard, it's hard to say whether they had no symptoms prior to that diagnosis as toddlers or if it was underdiagnosed. But what we do understand about asthma is that it is a hyperresponsiveness of the airways. And that hyperresponsiveness can be triggered by things that are in our environment, but also things that are inherent to our own body. And there's some literature that are now saying that there can be children who outgrow common frequencies of asthma symptoms, and it can resurge during other seasons of their life, perhaps with maternity, sometimes as seniors. So there's still a lot of research that needs to be done about what it looks like during different stages of life. But generally, what we do encourage families to do, even if a child has moved from more persistent symptoms to more intermittent symptoms, to always have access to short-acting inhaler so that in the event symptoms resurface, that they have access to the medication that will relieve those symptoms, because that is life-saving.
Well, thank you for sharing that. That was really interesting. Now, my last question is, what are some recommendations that you have for kids who are suffering with asthma, especially during today's environment with, everything that's going on with COVID-19 and stuff? What would you recommend for them?
Yes, so really important that we remember the foundations of healthy behaviors. So we want to ensure that we are sleeping well, that we are trying to manage stress, that we are eating healthfully, and that we are still engaging in physical activity. All of those things will culminate in us feeling better and decrease our risk of contracting diseases, contagious diseases. Now, regarding COVID, we do know that those with asthma might be at risk for more severe illness, not 100% risk, but there is slight risk there. And so the symptoms of COVID-19 can mimic those of asthma. And so if we are seeing an exacerbation of our asthma, but we have some other symptoms that are specific for COVID-19, such as fever, chills, headache, sore throat, that would warrant us seeking treatment. Usually we always recommend first contacting your primary care provider because they know your medical history and they know you and your family, and they will be able to give insight as to whether this is different from your usual pattern of disease, or not. And then they will be able to direct you as to whether you need to have any further testing or evaluation.
Okay. Well, that is all I have for today. I want to thank you so much, Dr. Robinson, for joining us for Asthma Awareness Month and sharing your insight on asthma.
Thank you so much for having me. It's been such a wonderful privilege to talk with you today.
Well, thank you. And everyone, as you know, it's Asthma Awareness Month, and if you have any additional questions or need any information, you can visit our website at www.asthma411.org or follow us on Facebook at Asthma411 or Safer Care Texas. We hope everyone stays safe and healthy and have a great day. Thanks.